sometime in October this year, they roll out for the new Measles Rubella vaccine will be added to the immunization schedule of Nigerians. There is no gainsaying the fact that advocacy, depending on the intensity, can make or mar any human endeavor, especially when it comes to vaccines and medicines in the health sector. So CWINS has been saddled with the responsibility of ensuring that very robust and well-spread advocacy is done prior to the rollout in October. I'm here to rub minds with both state and non-state actors in the line of advocating for the acceptance of these vaccines. The state actors comprises of the Honorable Commissioner for Health, and then the ES, who is the head of the state PAC agency, who are statutorily responsible for vaccinating Nigerians. And then thereafter, we also visit the line ministries that comprises of the education, information, women, the budget and planning, and of course, ALGO. Now, MROV. Why MROV? Before now, we all know about the menace that measles, causes, not just for children, but for adults too. And there is a single vaccine that has been used for years now. But of course, data have shown that measles is not just the only virus that is embedded, that is troubling, this bracket of, people, including young adults, that the virus rubella, through data and research, though it has been on for years, 50, 60 years ago, but here in Nigeria, it has not been one of those vaccines of killer against killer diseases in the children schedule of immunization. So this year, in the wisdom of the Federal Ministry of Health, in conjunction with Gavi and other partners, the National Primary Care Development Agency, and also CWINS, decided that, okay, this year is going to be part and parcel of the ROI schedule. So we are here to join hands with the state and especially the PAC agency and the health ministry and other line ministry to ensure that very wide publicity is given to this rollout. What is the wisdom there? When you start early, by the grace of God, you will end well. So in the wisdom of these stakeholders, if we start early now to share the rollout with the public, chances are that even if they are going to be dissenting or vaccine hesitancy from any level, this is the time to placate it. So that before we get to October, the course will be very clear. And even if there are going to be hesitancy, it will be minimal and could be, ignored or eliminated. My advice to all Bayelsans, my brothers in Yenagoa, all the local governments, is that they should shine their eyes. They shouldn't allow, people who, though educated, without basis, to deceive them and start giving them myths that will stop them from accessing this vaccine. They should try and always get first-hand information from the office of the ES to the office of the Honorable Commissioner for Health. Anywhere they hear about any dissenting voices concerning this MRV vaccine. And of course, they should go ahead and allow their children 9 months to 15 years, and then of course, young adults to access and accept the vaccine. It is proven that up to 90-95% efficacy, and it is for life.